And later on, if there is no postmortem, no one will know what was the reason of death. And most probably people think, okay, it might be MI or heart attack, the cause of death. In actual reality, it might be congenital issues.
So they run different screening programs, and usually when there is a sudden cardiac death, there are some protocols also to do the postmortem and to find the exact cause of death.
Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Imran Farooq. He is a cardiologist, and we will discuss some heart-related issues and their treatment options. Welcome, Dr. Farooq, to Faith and Discipline podcast.
Thank you so much.
Right. Okay, let's begin. My first question is, what is sinus rhythm?
Before going to sinus rhythm, we should understand how the heart works and what is the mechanism of the heart. So the actually heart is a pumping machine, is a bunch of powerful muscles, and they contract and they're pushing the blood from upper chambers to lower chamber and from lower chambers to the body, left-sided chamber, to supply the blood to the body. The main purpose is to supply blood and food to the body. So for this contraction purposes, so the heart has a very organized built-in battery and wiring system. So they comes with every man, every human being. It comes with every human being, a complete package. And the internal battery that comes with everybody, it gives the current, and the current goes through a structured wiring system to each chamber, and it makes the heart contract, and with each contraction the heart pumps the blood, ultimately supplies to the body, and with each contraction it gives one impulse. The regular, organized and synchronized way of contraction of all chambers, and the results of that to supply the blood to the body is we call it a sinus rhythm.
Okay. That seems quite a complex mechanism, but no one really gives a thought like how our heart works, because it seems very normal way of living, and it keeps pumping the blood every second, we can say so. But anyway, thanks for all the introduction. Right, okay, so that's the sinus rhythm. That's the normal way of pumping of the heart and the electrophysiology of the heart. But what happens when the things don't go according to the plan? And that's like arrhythmia. So what is arrhythmia?
Yeah, so this is the, as I just mentioned, that this is the electrical system of the heart. We call it electrical system of the heart. So whenever there is an irregularity, there is a problem, whether this is a problem of the battery or the problem of the wiring system, so it causes the disruption of this electrical system, and the normal regular beating of the heart, that is, by the way, is between 60 to 100 times a minute it should be. When there is a disruption of this rhythm, whether this is a slowing down of this system or the going into a rogue direction of this system, beating very fast or very slow, it causes it is called arrhythmias.
Okay. Because arrhythmia is like umbrella term, and it can be tachycardia or bradycardia. So what is the difference between bradycardia and tachycardia?
Yeah, so when the heart rate becomes too low, or it stops, sometimes it stops for a couple of seconds, causing the disruption of the blood supplies to the body, especially to the brain, for a couple of seconds. It is called a bradyarrhythmias, or the pauses, significant pauses we call it, in between the normal beating of the heart. And when it goes, as I mentioned previously, it goes into a very rogue direction, irregular, whether regular, goes beyond 100 beats per minute normally. Usually when it becomes rogue, it goes into 200 or 300 beats even per minute. So it is called tachyarrhythmias.
Okay. High beats of the heart, it can be temporary. If you are excited, emotional, your heart rate can go high. If it is temporarily, then I don't think there should be any issue with that, is it?
Yeah, so that is called the normal physiological process or response to the different condition of the heart, like in fear and flight, and different body conditions, like when you get a temperature, your heart beats fast. When you do exercise, your heart beats fast. So that is quite normal, and it is called the physiological response to the body, and it is called sinus tachycardia, or the normal regular beating of the heart in a little faster way to cope up the usual oxygen and blood supply of the blood requirement of the body.
Right. Okay. So now talk about the serious side of tachycardia. How many tachycardia types are presented, and which one can be dangerous for the human heart?
So, for the sake of simplicity, we can divide the tachycardia into two categories. One, we call it, that comes from, the heart has four chambers, as everybody knows, the two upper chambers and two lower chambers. When the heart comes from we can divide the tachycardias into two categories. That comes from the upper chamber, and we call it atrial tachycardia or supraventricular tachycardia. That, and the tachyarrhythmia that comes from the lower chambers, we call it ventricular tachycardia. Generally, the tachycardias that arises from the upper chambers, we call it supraventricular tachycardia or atrial tachycardia. They are usually benign. There is no immediate danger to the heart or the life. And the tachyarrhythmia that generated from the lower chambers of the heart, so they are usually they are considered as dangerous to the life, and they can cause a sudden cardiac arrest or death.
Okay. Does it have any connection to the brain stroke as well, other than heart attacks?
Yeah, so supraventricular, one specific type of supraventricular tachycardia, in which we call it atrial fibrillation, in which the upper chamber of the right or left side of the upper chamber of the heart, so there is an abnormal, you can say, excitation of the muscle, a short circuiting of the current that comes in a so repetitive mechanism that it makes the heartbeat irregular and very fast, and that with the result of that irregular heartbeat, the heart pumping action of that chamber, the pumping quality of that chamber in a regular way is diminished, is compromised, and the heart stays in that chamber for a longer period of time. And when the blood stays in that chamber for a longer period of time, and when the blood stays somewhere, it's stagnant, it makes a clot, and when this clot is formed, there are high chances that it can dislodge from here, and it goes to the systemic circulation, like in the brain, and causes a stroke. So this specific type of arrhythmia that we call atrial fibrillation have a high risk. People with that arrhythmias have a high risk of having a stroke.
Just quickly, would you like to explain the difference between atrial flutter and atrial fibrillation?
It's quite a technical question. For a layman person, it is a supraventricular atrial tachycardia that are treated in the same way, and there is no difference in the treatment. But for the technical terminology, so one arises from the left sided of the heart, and the other arises from the right sided of the heart, and that is the main difference, actually. Yes.
Let's move on to bradycardia now. What type of bradycardia can be presented, and can it be serious?
So generally the bradycardia that is you can say that requires attention, or we can say is the serious type of bradycardia, is a old age problem when the heart battery, internal battery of the heart and the wiring system, it becomes rusty and depleted, and it causes the very slow heartbeat and sometimes it also appears as a pauses between the normal beating of the heart. So when the heart pause, it crosses more than 3 to 5 seconds, so it becomes significant. It means that your brain doesn't get blood supply in that 3 to 5 seconds, and it causes the symptoms of dizziness, lightheadedness, and even collapse.
Okay.
And this type of bradycardia, most of the time it requires a pacemaker.
Okay. When you said bradycardia is like weakening of the electrical system and electrophysiology, does it lead to heart failure? Eventually?
Usually bradycardia doesn't lead to heart failure. It leads to the, as I told you, that stopping of the heart, and ultimately the certain chances of death or by stopping of the heart is there. And usually the tachycardia, when it stays there for a longer period of time, it means that heart works more and more and it can lead to the heart muscle weakness.
Okay, right. Right, so we talked about tachycardia and bradycardia, like what it is and how serious it can be. Would you like to tell us what is the reason behind why we suffer from tachycardia or bradycardia?
So tachycardia, the most common and most serious cause of very dangerous tachycardia that can lead to a sudden cardiac death, we call it sudden arrest or sudden death. The name is ventricular tachycardia or ventricular fibrillation, and the most common cause is blockage in the heart arteries. So when the blockage in the heart arteries happens, we in general term we call it when the heart attack happens due to the blockage in heart arteries, it suddenly cessates the blood supply to specific area, and from that specific area the heart goes into a rogue direction very fast and people die suddenly at the spot.
Okay. So myocardial infarction is one of the reasons. Is there any congenital issues that might be present in the patient that might lead to tachycardia or bradycardia later in life? Or is there any other reasons in the body that might lead to?
There are, especially in the young individuals, there are couple of congenital conditions that runs in the family that can lead to this type of tachycardia. And ultimately ventricular tachycardia, or that lead to ventricular tachycardia and fibrillation are usually the same terminology, one without you can say for the layman's sake, or one without blood supply and very low blood pressure, without any blood pressure, and the one can be with the detectable pulse and the blood pressure, or without ventricular tachycardia. So both of these are the dangerous tachycardia. These are considered, especially if there are some congenital problems that runs in the families, and people present in very young age with ultimately with these type of tachycardia, and they can die suddenly in very young age.
That might be one of the reasons of early death in young adults, because people might think the person might have a heart attack, but the reason might be congenital that leads to.
Definitely. Young adults usually die with this type of tachyarrhythmias called VT or ventricular tachycardia or ventricular fibrillation.
Yeah. But my point is like in certain countries when there is no proper diagnosis, or there is even in advanced countries where there are technology is available, but there is no like possibility of the opportunity to diagnose the patient, and without the diagnosis the person might die, and later on if there is no postmortem no one will know what was the reason of death. And most probably people think, okay, it might be MI or heart attack, the cause of death. But in actual reality, it might be congenital issues. That was my point.
Yeah, this is a very important actually issue. What I noticed, I have worked in different countries and including Pakistan. What I noticed that this is true in our part of the world, that people go unnoticed. The sudden cardiac death go unnoticed in young adults. Yeah. But in this part of the world, in England, so there are a couple of screening program and different cardiology department in different part of the country. So they run different screening programs. And usually when there is a sudden cardiac death, there are some protocols also to do the postmortem and to find the exact cause of death. Here I am not aware exactly what are the protocols, but there must be a protocol here for a postmortem for sudden death in young adults.
Young adults. Okay, right. Is there a way someone can prevent tachycardia or bradycardia? Is something we can do?
So again, it depends upon the cause. So if it is congenital, so we can divide into a congenital causes that runs in the family, or and the acquired causes. So if there are congenital causes, this is not in our hand. So unfortunately, we cannot. We can prevent the tachycardia in the form of, we'll say that some medications we can use that can suppress the excitation of the heart muscles that lead to these tachycardias. And there is another form of prevention that we can implant a special device that can detect this type of tachycardia, and it gives the shock and revert the tachycardia back to the normal rhythm. So these are two preventive measures in young adults mostly with the congenital causes. For the acquired causes, definitely it can be preventable, like the heart blockage and the coronary artery disease, we call it. So we can prevent it with the lifestyle and with some medications and healthy lifestyle, exercise. We can at least delay the chances of having this heart attack.
Okay. So what are the tests available to diagnose the arrhythmias?
So the basic test actually, as we raise the suspicion, is the usual way of diagnosing any condition in medicine. So we raise the suspicion on history and clinical examination, and the basic test that we can do anywhere that is readily available is ECG. So if there are some changes that can raise the suspicion of having a congenital heart disease, or the blockage in heart arteries, coronary artery disease, then we could move forward for further testing accordingly. So there are nowadays the home monitoring devices like the smartwatches. There are other devices that are available very readily on Amazon, like 100 pounds device. So if people who have the symptoms of palpitation or racing heart or dizziness or lightheadedness, they can use these watch devices to to monitor their heart rate at home. And these devices are so sophisticated these days that they can record the ECG 10 to 30 second ECG strip also on the applications.
Okay, how accurate is that, the smartwatches?
Yeah, so they or not, we can say that I do not know the sensitivity or specificity of this, the diagnostic accuracy of this test at the moment. But I mean, they are not very accurate. I mean, they need, for interpretation, they need a qualified person to interpret them. But at least they can, the patient, they can get the data, they can record the data in their mobiles, and they can show it to the physician. What we do normally in our practice, we advise if the people who are using these devices, or we advise them to suggest them to use these devices, we ask them to send the data to us via email, and we'll check that data and we'll act accordingly.
Okay. If someone is presented to the GP, like they have spells of dizziness, that might be due to low hemoglobin, iron deficiency, can be other reasons as well. But if they presented, if they have a racing heart, or maybe they're too emotional, so, and a GP reckons like they need further investigation and they refer the patient to you as a specialist, how would you deal with their case? What do you do? What test would you prefer to perform?
Normally, it depends upon the duration of symptoms and the frequency of the symptoms mainly. So we can have a system. We can arrange 1 day to 5 days temporary monitoring devices that we can. It's a small devices we can place on the patient's chest wall and send them home. And this record the 24 hours, 48 hours, or whatever the duration is, up to 5 days. They can record the ECGs of the patient, and the patient, when patient returns the device, we can retrieve that data and we can evaluate that data. So these are called the ECG monitoring devices, long-term ECG monitoring devices. So on the basis of symptoms and frequency of symptoms, we advise usually these tests, these investigations. And also along with that, one of the initial investigation is the ultrasound scan of the heart that we call. It's a jelly scan of the heart. We call it echocardiogram. So it tells us about any structural abnormality of the heart, like any weakness of the heart muscles that is substrate or you can say precursor of dangerous arrhythmias, and the valvular heart disease, the valve problems, leaky valve or the tight valve, that shed some light on probability of having a cardiac problem.
If they have an issue, what is your advice for them?
I have seen patients who have a very severe tight or leaky heart valve without any symptoms even, or with minimum symptoms, and they present to the doctor for some other reasons, and they diagnosed with this heart condition, and they go on a surgery and get it done. So it happens. So it can happen two ways, like people doesn't have symptoms, or people have symptoms and they ignore their health conditions or the symptoms. For that, I would advise that everybody should know about the common symptoms of heart problems. There is no many symptoms of heart problem, only a few, like chest pain for the heart attack or the angina or blockage in heart arteries, shortness of breath for all the valvular issues or weakening of the heart muscles. And for arrhythmias that we just talked about is the dizziness, lightheadedness, collapse episode, or the palpitations. So these are few symptoms that everybody should get worried if he gets these symptoms, significant symptoms, and that is not usual to his or her health state in routine.
Okay. Right, so you have done the diagnosis, you know the problem. How would you treat the patient?
It depends upon the diagnosis. So particularly for arrhythmias, as I told you that we first diagnose and we reach on a conclusion what type of arrhythmias it is. For example, if it is a tachyarrhythmias, so then we usually investigate the cause. Like there are two major causes, like structural heart problem, like any valvular problems, or could it be a congenital, or the third one is the most common one and treatable one is the coronary artery disease or blocking in the heart arteries. So most of the time when we treat the cause, the arrhythmias goes away. Arrhythmias is usually secondary to these conditions. If it is the congenital one, so then here comes the prevention part. So with the medication and with this special device, we call it ICD. It's a kind of shock device. It's a kind of pacemaker that can give a shock when these type of arrhythmias happens. So we implant if patient qualifies, we implant these devices, insert these devices into the patient heart. And the second important thing is in congenital conditions that runs in the family, we usually investigate or screen the family members, immediate family members, siblings, and the patient family. We have for every congenital condition we have a specific guidelines to screen.
Okay, right. If the arrhythmias are present, you mentioned like pacemaker and ICD, you would implant. So how do you decide which device is suitable in that particular case?
So there are different indications. So generally for bradyarrhythmias, the heart becomes too slow. It means that heart original wiring system and the batteries, they become rusty. So we need to replace that with the normal pacemaker. So we can put a pacemaker. Pacemaker is a device that comprises a generator, a battery that we keep it outside the heart under the skin and on the chest wall, and we put the lead of the wire of the battery attached to the battery. We put that one into the heart chamber. So we can decide accordingly. There are different indications for whether we would put one lead or two lead in one chamber or two chambers. So these are called normal pacemaker devices that helps to helps to get the heart beating appropriately. The other special devices that we call special type of pacemakers. So there are different indications for these devices. One is as I just mentioned, that it is a special pacemaker device that gives the shock. Sure. And the second one is when the heart muscles weakens, and we call it heart failure. So in advanced heart failure, it means that one chamber of the heart is not beating properly because of the weakened muscles walls of that side, and the other side of the heart is beating appropriately or more than this one. So in that condition, the both chambers, they are unable to beat in a simultaneous way and pushing in a synchronized or simultaneous way to pushing the blood to the body. So for that condition, we have a special pacemaker. We call it biventricular pacemaker. So we put the wires in both of the chambers. One on the left side of the chamber, we put the wire outside we contract both of the chambers simultaneously. Okay. Gives the current and makes the heart pumping action better.
Okay. For our viewers, would you like to tell us the size of the pacemaker? And how is it implanted? Is it open heart surgery, or is it just like minor invasive procedure? How long does it take? And is it under general anesthesia or local anesthesia? How does it happen? Yeah.
So normal pacemaker is a device that comprises of two parts. One is the lead that goes inside via the piping system of the heart, goes inside the heart chamber, mm-hmm. and we fix it into the heart chamber, mm-hmm. on a specific wall. And it attached to a small battery that is you can say size of a matchbox. Yeah, so it's rather smaller than a matchbox, half the size of the matchbox. And this battery, we make a pocket under the skin on the left side or the right side of the chest wall, and we place that battery there, and we attach both of the wire and the battery with each other. It is usually it takes half an hour to 45 minutes. You can say it is a minimally invasive procedure, and it doesn't need a general anesthesia or to knock the patient down. Mm-hmm. So we just numb the area. We give some medications to relax the patient, to put him on a light sleep. Mm-hmm. But these are not anesthetic agents, sedative agents we call it. And we numb the area, and we give a small cut, and we from that cut we further proceed to to put the wire and the pacemaker. Mm-hmm. And at the end of the procedure, we sew the pacemaker, that incision wound, okay. with the sutures, and right. That's all.
Right. What are the precautions patient needs to take after the procedure?
So for initial, there are not too many. So initial couple of days, we advise that patient should not move that side of the limb excessively. Don't do any strenuous exercise. Walking is all right, and normal household is all right. Don't carry weight on that side of the arm. And if we usually advise that if there is any oozing, any bleeding, any color change, or any swelling happens, he should contact us back. And most of the time, and especially if he is on any blood thinner medication, so we need to stop these blood thinner medications for initial 1 to 2 days before the procedure, and we stop it, we restart it after 24 hours usually.
Okay.
So these are the few precautions that we advise just after the procedure, and within 1 to 2 weeks when the healing happened, then there is usually no precautions. He can just live his normal healthy lifestyles.
Okay. And that's the general precautions. What about the pacemaker itself? Would they feel any difference? Is heart pumping normally? Is, if the heart is racing up or, slowing down, or any, abnormal type of electric current in the heart, there is a possibility of things can go wrong. Is there any possibility like that?
Yeah, so we actually, when we send the patient home after the procedure, so the last thing we do before sending him home, we check the pacemaker parameters and we adjust them according to the needs of the patient. And most of the time, 99%, there are no symptoms. Some people, they do get symptoms of these all symptoms of very fast heartbeat, very slow heartbeat, and very few people, they can feel that when the pacemaker start working, and they feel that typical feeling of a click in the, you get thumping sensation in the heart. Okay. So usually these are benign symptoms, and people, they are usually get used to it after some time. And if they get any unusual symptoms like shortness of breath, very fast heartbeat, racing heart, palpitation, dizziness, they should contact back to us because we need to recheck in that scenarios.
Right. So as we know, technology has advanced and we can take the data from a pacemaker. Is there a possibility of hacking someone's pacemaker and sabotaging it?
Yes. So it's there are some theories about that one, and I have watched a movie about that one also, that pacemaker has been hacked and it was terminated, but practically it is not possible. And they are very you can say the safe devices, and every device has a unique reference number, and every device can only be operated by the specific monitor that has been given to every patient with the pacemaker. So whenever they turn it on, there is a chances of we normally do the remote monitoring of the pacemaker. We call it remote interrogation of the pacemaker, but it can only be possible with the special type of device that are you can say synchronized with that pacemaker only. So it is not possible without knowing the specific type of the pacemaker, I believe so.
Okay, right. Okay. So how long the battery of the pacemaker lasts, and how long the pacemaker itself lasts? Yeah. What's the life of it?
So as pacemaker has two parts, like wiring system. So wiring system and the battery. So wiring system is lifelong. So you can remove it if there is any infection, or you can remove it by yourself, but it is a lifelong hardware. The battery, we call it battery or generator or box of the pacemaker. So it's the second part. So this it has a life. Normally, it depends upon the usage of the pacemaker. So if the pacemaker, for example, if the usage is 90% or 95% of the, you can say, of daily heart beating is dependent, we call it pacemaker dependent. Okay. So if the heart is dependent on the pacemaker and it uses 24 hours the battery, the battery will deplete quickly, but normally it takes 5 to 7 years in that case. Okay. Even.
So the patient comes back after 7 years to get it replaced.
So yeah, we have a clinic that we usually check the patient. We do the monitoring of these pacemaker devices annually, and when we interrogate the pacemaker, it also tells us longevity of the life of the pacemaker also. So it gives it alarmed when 6 to 8 months left, and we usually book the patient for a pacemaker box change or battery change within these 2 to 3 months.
Okay, right. As you said, like pacemaker works according to the requirement of the patient. So is it intelligent device? Like it knows how much I need to give the electric current. Does the patient really need the electric current at the moment, or but when the patient is sleeping, I need to slow down? When the patient is doing some exertion, activities like sports and things like that, I need to work faster to speed up?
Yeah, it is very good question. And these pacemaker, the modern day pacemaker, they are very intelligent device. They are mini computers. They can sense patient own beating, heart beating, and they can stop their working. And they have we call it a rate responsive what we call it is the option there. So there is a rate responsive option there. So it also sense that when there is a need of a heart to beat faster pace, and when there is a need of the heart like faster pace in exercise or in walking, and when there is a need of heart to beat on a normal pace or on a slow pace. So it has a minimum target and the maximum target also, and it remains between that one, but it sense it, we call it rate tracking option. So it tracks the heart owns rate and the need of the oxygen and the heart beating, and it adopt itself accordingly.
Okay. Right, thank you very much. My final question, what are your recommendations to the general public? How can they keep their heart healthy?
Yes, this is a very common question that probably you can ask everybody, every physician. So to me, it is a combination of diet and I can call it a healthy lifestyle. So what does this mean is a combination of your diet and your lifestyle in terms of exercise and different your daily habits like avoiding sedentary lifestyle, keep walking, keep yourself fit and healthy, and not only physically but in your mind also. It is very important. And also stay away from the unhealthy junk food like fatty fried foods. So these are the general rules, and everybody knows that one. So but we have to maintain it and practice it on a regular basis.
Thank you very much, Dr. Farooq, for your time. I believe our viewers have found this information useful.
Thank you so much.
Many thanks for watching this episode. If you found this useful, you can share with your family and friends. If you haven't already, make sure to subscribe to this channel. Thanks for watching.